Hello guys, welcome back to my YouTube channel. If you are new here, karibu sana. If you are a returning subscriber, thank you for always coming back to watch my amazing videos. In today's video, we will be talking about painful sex. I'll be telling you about the classifications, the causes. We will be exploring if it's normal or not. Also, what you can do to help yourself. We want to know when you are having sex. Is it the beginning of sex during penetration? Is it superficial or is it deep? Is it on the clitoris or is it on the lips? So let's talk about the anatomy so that we can be on the same page. So this is the this here is the area you see. It is the vagina. The vagina is this hole in the middle here. You can see the other parts, the inner and the outer lips, the clitoris, and etc. Then you don't pee out of the vagina. Urine pass out through the urethra. All of these together are called your vulva, and the space between the anus here and the vagina is the perineum. Let's get into the painful sex, and is called dyspareunia, and it happens to both men and women, but it is more common in women. Pain can be due to a physical cause or it can be emotional. Your emotions can cause that as well. So dyspareunia is classified into two types, that is superficial pain and deep pain. The type gives you the clue of what the cause of the pain is. So superficial is pain that is at the opening or at the entrance of the vagina, and it's the pain you feel when the penis is just entering the vagina, and it can be a sharp pain, stingy, and it can affect the vagina itself, or the clitoris, or the urethra, or even the labia. Deep pain is a little bit different because it's more during sex, and it can be felt higher up in the vagina or in the pit of the stomach. It is due to thrusting of the penis during sex, and it can be achy. So let's begin talking about the causes, because when you are feeling the pain, helps to point in the right direction about what's going on. One of the commonest causes of superficial dyspareunia is vaginal dryness. If you are not aroused or excited enough before sex, the vagina doesn't have time to produce fluids and to lubricate itself, and therefore sex can be painful. Other times, the vagina can be dry due to reduced amount of estrogen. This happens if you have just had the baby. It can happen when you are breastfeeding. It also happens in menopause. Some medications can also give you vaginal dryness. For example, some antihistamines, which can do birth control pills. The other cause is vaginismus. It is a condition where the muscles around the vagina and also around the pelvic basically are too tight. Vaginismus is the body's automatic reaction to the fear of some or all types of vaginal penetration. This is something that is actually out of the women's control. When it's in severe form, it's almost impossible to put anything in the vagina. That is, whenever penetration is attempted, your vagina muscles tighten up on their own, Even gynecological examinations may be really difficult at times. Even wearing the tampons, that could be impossible, yeah? But it can be quite difficult to treat. But if it's mild or if it's moderate, sometimes relaxation technique, music, will relax the muscles. In severe cases, some women will have counseling, yeah, and therapy to help them to understand this. The next cause is genital injury. If you got any kind of cut or sores around the vaginal area, it's going to be painful, especially when you are having sex. For example, having a cut or shaving yourself and then you cut yourself, that can cause pain, yeah? The next cause of superficial dyspareunia is infections or inflammation. That is, if you have ever had a UTI, you can find that the pain can be around the hole where urine is coming out of, yeah? So this is because that hole, that is the opening, becomes inflamed, yeah? And that's called urethritis. So during sex, there can be friction on this area and makes sex painful. Another example will be genital warts, yeah? That is having sores around the vulva, which can cause pain during sex. Having thrush can make the whole area feel swollen, or it can be red, and the lining of the vagina can be really tender, and trying to have sex or trying to put on a tampon can be very painful. Next is having skin disorders such as eczema, which is typically wound associated with the skin down there. The eczema can cause irritation, which gets worse when trying to have sex. Also, there are a couple of conditions which can cause scarring of the tissues, yeah, around the vaginal area. This means it doesn't stretch too much, and having penetrative sex can be painful. If you love perfume soaps for your vagina, femme fresh wipes and soaps, and maybe conditioners, this can irritate the skin around the vagina, and this can be enough to give you superficial dyspareunia. A rare case is some conditions which women are born with, and it usually affects the development of the vagina. Sometimes the vagina can be underdeveloped with, for example, a partition, so it makes penetration painful. There is also a conditions where the hymen is like a membrane that surrounds the vaginal opening, and the membrane is really covering the opening, so it's really difficult to have sex, and it can be painful if you try to. Deep pain dyspareunia is due to medical conditions or medical treatments. In medical treatments, it's, for example, maybe surgery to any of the pelvic organ, for example, uterus or oviduct, which can cause burns or scar tissues, which can make everything stuck together. So having sex might cause tension between the structures and might be very painful, leading to medical conditions that can cause deep dyspareunia, say fibroids, for example. Fibroids are growths of the uterus, and you can have one or several fibroids, yeah? They usually make the uterus quite bulky, and some women might have a mass like pregnancy. So during sex, when the penis is touchy, the cervix, which is part of the uterus, that's inside the vagina, it's almost moving the cervix around, and it brings about a strange and uncomfortable feeling and brings pain, especially if the uterus is heavier and bulkier than normal. Another cause of is endometriosis, yeah, and it is a condition where the lining of the womb, which should be growing in the uterus, starts developing in other parts of the stomach, yeah. So it has some of the bowel, some on ovaries, yeah. Having sex when having endometriosis can be really painful. You can experience severe abdominal pain. Another cause of deep dyspareunia is ovarian cysts. Ovarian cysts are fluid-filled sacs that develop on the ovary. They are very common and they do not cause any symptoms. So sometimes because of the position of the ovaries, this can really press on the vagina, and sex can move the ovary up and down and around, and it can be really uncomfortable. Another cause is pelvic inflammatory disease, yeah. This is when the organs in the pelvic, yeah, for example, uterus, ovaries, fallopian tubes, etc. If these are inflamed because they are infected, this will typically happen with some STIs. The inflammation causes the organs to be kind of stuck together. They don't move about as freely, and sex can be really uncomfortable, yeah. Cystitis is another cause. Is the inflammation of the bladder, usually caused by bladder infection. I talked about UTI causing superficial dyspareunia because the opening where the urine is coming out is not flamed. Well, the bladder can be inflamed when you got UTI, and this can give deep dyspareunia. Because of the way our organs are positioned inside the bladder actually kind of sits underneath the uterus. So the movement of the uterus can also affect the bladder, and it can be painful, yeah. So women that experience irritable bowel syndrome and things like bloating, diarrhea, and things like constipation, they also can suffer from the pain deep in the pelvic due to sex. Now to move to the emotional causes of dyspareunia. Pain is really linked to emotions, so how you are feeling or sexual perception of pain is not different to pain during sex, yeah. Women who have had like a traumatic experience of sex in the past, maybe because of rape or sexual violence or abuse, can find sex very painful. The same goes for women who have feelings of anger towards their partner, or if feeling scared or worried about getting pregnant. Any kind of negative emotions towards sex can heighten your perception of pain. Suffering from anxiety and depression can also give pain during sex, because if you are anxious or depressed, it's quite difficult to get aroused, which means that your vagina can be dry, and that can give you superficial dyspareunia. Stress actually causes you to tighten up your muscles around your vagina and your pelvic muscles, yeah? So now, it's even harder to penetrate, and then it causes even more pain. When going to hospital, be ready to explain. When do you have pain during sex? Is it at the beginning of sex during penetration? That is it superficial or is it deep? So inserting a gloved finger by a doctor is usually to try and see if they can fill the ovaries. For example, if they are bigger and bulkier than they should be. Are you having a sensitivity in the cervix is touched? Insertion of speculum, which stretches the wall of the vagina and allow you to peep and see the cervix inside. It also allows you to look at the rest of the vagina and see if it's healthy or any cuts or having any inflammation. It's not a painful procedure, but of course, if you are suffering, for example, from vaginitis, tism and vaginismus, or superficial dyspareunia, you might find it a little bit more uncomfortable than normal, but your health officer would use lots of lubrication to make sure that the examination is as comfortable for you as possible. You might get anxious or worried at this point, and you might be asking yourself whether or not the speculum will fit. If you can fit a penis in your vagina, you will be able to fit this speculum in the vagina, so don't worry about that. Finally, the ultrasound may be necessary because there are so many causes of painful sex, and the treatments really depends on the cause. If the cause is vaginal dryness because of low estrogen, estrogen can be replaced by using a gel that goes inside the vagina that has estrogen. This will help with the lubrication purposes. If the dryness is because of not being aroused before sex, I recommend you to spend more time on foreplay, or you can use lubricants, for example, KY jelly. I use water-based lubricants because if you use oil-based lubricants, for example, Vaseline on top of your condom, this can be a problem and you could get pregnant because oil-based lubricants, they dissolve the latex of the condom. That is, they damage the condom. If the pain is due to infection, for example, yeast infection or thrush, treatments will be anti-yeast tablets, creams, or creams. If pain is due to endometriosis or fibroids, then treat endometriosis and fibroids, and sometimes this could be done with medication and sometimes it requires surgery. When the pain is due to emotional causes, then the treatment is to get to the roots of what is causing your emotions. Pain during sex is not due to a problem. For example, if during penetrative sex and the uterus is being moved around, so you have to use less force or don't penetrate deeply. Some may not experience pain unless they are in certain sex position, so change your position and this will help. If you're noticing like you're getting pain after using certain products, this is a sign you are getting irritation of the skin around the vagina or vaginal lining, so stop using those products. Emotional solution is also to talk to your partner. For example, you are feeling nervous or it's your first time or you are worried about getting pregnant. If you actually let your partner know that what you are feeling, these things could be comforting enough to reduce the anxiety. So my people, what do you think up to that point? I hope that you found that video helpful up to that point. If you found it helpful, kindly like, subscribe and share. I don't mind if you leave a comment. Bye bye for now. Let's meet in our next video.